Second white coat. Subscribe and like. Let's learn medicine together.
Today, we've got a real medical detective story for you. We're going to connect the dots between a failing heart and a very specific, almost eerily symmetrical pattern of damage in the brain. It's a fascinating case where the final clue, the thing that explained everything, was only revealed at the very end, showing us a surprisingly logical vulnerability in the very plumbing of the brain. So let's get right to the heart of the mystery. A patient's heart gives out. You might expect some brain damage, right? Sure, but why would it show up as a perfect, bilateral, mirror image pattern? It just seems to defy the randomness we usually expect with strokes. Let's dig in and figure out what could possibly cause something so precise. To piece this all together, we've got to go back to the beginning, back to the emergency room, where the medical team was facing a patient whose condition was getting worse by the minute. Our story starts with a 57-year-old man. He's brought into the ER, found completely unresponsive, and right away, his medical history puts the entire team on high alert. As they examine him, the puzzle pieces start to click into place. He's unresponsive, he's got a high fever, his blood pressure is in the basement. They can hear crackles in his lungs, that's fluid backing up, and then they find this smoking gun, a brand new heart murmur. This isn't just a random list of symptoms, this is a classic picture, and it's pointing in one very specific direction. So here's the deal. When you combine a fever, a new heart murmur, and a history of illicit drug use, one diagnosis just screams out at you: infective endocarditis. The diagnosis seemed pretty clear: a dangerous infection on his heart valves. Tragically, despite everything they did, the patient's condition worsened and he passed away. But his story doesn't end there. For us, this is where the real mystery actually begins. Clinically, the story seemed tragic but straightforward. The autopsy, though, revealed a finding in the brain that was anything but. And when they examined the brain, they found something just bizarre. The damage wasn't random at all. It was perfectly symmetric on both sides of the brain. The dead tissue, the necrosis, had formed these distinct wedge-shaped strips. They ran right along the outer curves of the brain, almost like parallel racing stripes on either side of the midline. And here's the big contradiction. We know that heart infections like this can shower the brain with tiny clots, or emboli, but that process should be random, like a shotgun blast, causing patchy damage here and there. It should absolutely not cause a perfect mirror image pattern. So what on earth could possibly explain that kind of symmetry? To solve this, we've got to trace the chain of events. It's like a domino effect that starts in the heart and ends with this really unique, specific pattern in the brain. It all happened in 3 key steps. First, that infection just destroyed his aortic valve. His heart failed, sending him into what's called cardiogenic shock. Second, this shock caused a massive system-wide drop in blood pressure, starving the entire brain of blood flow. We call this global cerebral hypoperfusion. And third, and this is the key part, this global drop didn't affect the brain evenly. It selectively damaged the most vulnerable regions, creating the exact pattern we saw. This brings us to the core concept that unlocks the entire mystery. To understand this strange pattern, we need to talk about the brain's watershed zones. Okay, think of the brain's blood supply like 3 massive irrigation systems: the anterior, the middle, and the posterior cerebral arteries. A watershed zone is like a patch of farmland that sits at the very, very end of the line, right on the border where 2 of those different irrigation systems meet. So if the water pressure for the whole system suddenly drops, where does the land dry out first? Right there at those farthest edges. And you can see that concept perfectly right here. The brain has these huge territories fed by major arteries, the ACA in orange, the MCA in teal. But look at those purple areas. Those are the watershed zones, sitting right on the vulnerable borders between these major supply lines. They are the last to get blood and the very first to lose it. And that is the key to the symmetry, because these vulnerable zones exist on both sides of the brain at the exact same anatomical borders. A global drop in blood pressure hits them equally and at the same time. This is the mechanism that produces that eerie, bilateral, symmetric, wedge-shaped damage. It's not about a single clogged pipe. It's about the pressure in the whole system failing at once. Now, any good detective has to make sure they've got the right culprit. So let's quickly run through the other usual suspects for brain injury and see why they just don't fit the evidence in this case. Let's compare our main suspect with the other possibilities. A typical embolic stroke, that's going to be asymmetric and patchy. A hypertensive bleed, that usually happens deep inside the brain, not on the surface like this. As you can see, only one mechanism, global hypoperfusion, perfectly matches the symmetric pattern found at the autopsy. All the others just don't fit. So, we've solved the mystery. We've connected that failing heart to the symmetric brain damage. Now, let's lock in the single most important takeaway from this entire case. So here's the entire sequence, all laid out. The trigger is systemic shock. The mechanism is a global drop in blood flow. The most vulnerable areas are those watershed zones. And the result? The pathological signature is that bilateral symmetric death of cortical tissue. And that's our final takeaway. The pattern tells the story. The next time you see a case involving profound shock or hypotension and you're thinking about brain injury, remember this specific, symmetrical pattern. It's not a random event, it's a footprint left behind by a brain starved of blood at its most vulnerable borders.